My name is Courtney Cheatham, and I'm in the Problems and Solutions class for the 6th period. Amputation is the removal of a body extremity by trauma, prolonged constriction, or surgery. As a surgical measure, it is used to control pain or a disease process in the affected limb, such as malignancy or gangrene. Depending on where the amputation is, the recovery varies. For leg amputees, most use the exercise of bridges or back bends to strengthen the hips. This is repeated daily, and eventually adding on the use of a prosthetic. The procedure starts with a clean incision around the affected area and can actually be very fatal. The most common reason for an amputation is poor circulation. Circulation can be damaged by the narrowing of arteries. PAD is peripheral arterial disease. This can cause the need for amputation in adults, usually ranging from 50 to 75 years old. PAD can also be caused from diabetes or atherosclerosis, which is plaque buildup inside of arteries. When blood vessels become damaged, the blood flow to the extremities is impaired, and tissues start to die and may become fatal in some cases. Gangrene can also cause the need for immediate amputation for some people, and amputation can also be performed for acute and or chronic infections that don't respond to antibiotics or surgical removal. A thickening of nerve tissue that may develop in various parts of the body, also known as neuroma, such as frostbite. Patients with diabetes or heart disease or infections have a higher chance of having complications from the amputation than someone who doesn't have these conditions. Above-knee amputations are more likely to not strongly recover. Clearly, there can be complications as well, such as joint deformity, a hematoma, infection, wound opening, or necrosis. Pulmonary embolism pose a risk for the aftermath of an amputation due to immobilization. Amputation can be practiced while patients are asleep under anesthesia or while awake under spinal anesthesia, which takes the feeling from your waist down. After the procedure, doctors highly suggest you call if you have any of the following symptoms: fever, chills, redness, swelling, bleeding, drainage from the incision site, increased pain around the amputation site, numbness and or tingling in the remaining extremity. After amputation, most doctors encourage patients to stop smoking, trying to maintain an ideal body weight, exercising regularly, controlling blood sugar if it's needed. In the past decade, doctors and scientists have actually come together to create an advanced prosthetic that can move and grasp objects with the precision of a human hand. And they're thinking that it's controlled by the human mind.